So we do have that framework where schools, if they see that there are an increased number of children who are ill because of respiratory illness, again, or teachers or staff, they can work with Alberta Health Services. And in some ways, that is adding an additional layer of protection, because if individuals choose to not get tested for COVID but are home with an illness, they're now counted in the list as being part of that outbreak. And so it's less dependent on needing a test to be a part of identifying where there is an issue. We are, as I mentioned, working with education to determine if there are any adjustments that need to be made to this framework, but there are no other settings right now, aside from continuing care and acute care, as locations where there's a significant risk of transmission and severe outcomes if there should be an outbreak. In those settings, we are ensuring that follow-up takes place to mitigate and to manage outbreaks. However, in schools, again, we are taking the approach that an illness that fits that definition, respiratory illness, is treated the same way, whether it's someone who's diagnosed with COVID or not, and that additional measures can be put into place